Hi, welcome to the next episode of Absolute Talks. Today we're going to be discussing Shade Taking 101 with our very own Jay Brill. Jay, why don't you tell me what you do here at Absolute?
Well, Jack, I am the manager of the staining glaze department, and
Nice.
I also do the custom shades and custom stainings for our doctors and their patients.
Very good, very good. So when a doctor is in the office and they're preparing to take a shade of a patient, what are some guidelines that you would like to talk about to help him give us the best information he can?
Take shade as soon as patient gets to office before their teeth dehydrates. Rearrange your shade guide to value shade guide. Hold shade tab incisal edge to incisal edge and have the patient open their mouth to create a uniform background. Remember to always take the shade tab picture with the shade ID in frame. If you are uncertain of the shade, especially the value, which is important, and if it's between 2 and 3 shades, it is very helpful for us to have both shade tabs in the same picture, held incisal edge to incisal edge to the tooth we are trying to match, as the example shows. You can send us as many pics as you'd like, and you can email them to shades@absolutedentalservices.com. I'd like to share some common mistakes we see with shade pictures. First, many people believe that we can take a shade off a color-corrected computer screen. The most valuable information a technician can have is a picture with a shade tab in the same frame as the tooth. Second, many times we get shade pictures where the shade tab and tooth are not on the same plane. We need to make sure the lip doesn't cover the tooth we are trying to match. It is also important to note that the shade tab must be held to the tooth that we are trying to match, not the tooth we are restoring. Third, having the tooth and shade tab in focus allows us to identify the nuances in the tooth we are trying to match. Many clinicians are even using their cell phones to take these pictures. Focus is more important than zooming in. We can always enlarge the picture with our lab software. Zooming in will lower the quality of the picture. Move the camera as close as you can to the patient without going out of focus. Here's an example of an ideal shade picture. The tooth is not dehydrated. We can see the translucent levels. The patient's mouth is open and lips are retracted. The shade requested is based off value, not chroma. And the shade tab and tooth to be matched are held incisal edge to incisal edge on the same depth or plane, and both are in focus.
And a lot of times too, with our design capabilities we have in 3Shape, we can incorporate a full face photo actually into the design software. So a lot of times what you can do with your patient also, beyond shade taking, is if you have them hold their head completely level, have them hold a box of Kleenex up against the wall, take a picture straight on with the big smile, they call it. And that way we'll be able to import that photo into the design software. Has your results thus far been really successful?
Very successful.
Studio?
Very successful.
These are really, really good tips and a lot of what we see from the laboratory as far as what our needs would be. And, it should help you in your practice.
I agree.